Sleep is one of our fundamental needs as human beings, and yet almost all of us will experience some sort of sleep disorder in our life. In this video, we are going to take a deeper look into one of the most common sleep disorders, insomnia. I know you probably have heard of it before. Let's begin by understanding what really is insomnia. Insomnia is a sleep disorder where you have trouble falling or staying asleep. You might have trouble to go to sleep, or you might have trouble to stay asleep, which means you might wake up frequently at night. The condition can be short term, which we refer as acute, or it can be long term, which we refer to as chronic. The condition can also come and go. Acute insomnia may last from one night to several or few weeks, while chronic insomnia may last for a period of 3 nights per week for the longer period of 3 months or more. Insomnia is divided into 2 types. The first one is the primary insomnia, and we have the second one as the secondary insomnia. In the first one, the primary insomnia, your sleep difficulty is not caused by any pre-existing health illness, while in the second one, your sleep disorder may be caused by a pre-existing illness or health condition such as asthma, arthritis, depression, anxiety, heartburn, or substance use such as alcohol. Having looked at the types of insomnia, let's also look at what causes each of these types of insomnia. The first one being the primary type, which is not, as I said, caused by a pre-existing illness. You might ask, what causes such type of insomnia? While stress due to major life events such as losing your job or losing a loved one or divorce can lead to difficulty in sleeping or lead to insomnia, the primary type. Also, things around you such as light or noise or even temperature can lead to difficulty in sleeping. That is for the primary type of insomnia. As for the secondary type of insomnia, as I said, which is caused by pre-existing illnesses or health problems, such as mental illnesses or mental conditions like depression, anxiety, and other illnesses such as asthma, arthritis, or pain due to trauma or accident can lead to sleep difficulty. The use of medications to treat some of these illnesses might lead to sleep difficulty, as well as substance use such as alcohol, caffeine, or tobacco could also lead to sleep difficulty or insomnia. Having discussed all of those, let's now move to the risk factors. When we say risk factors, we are talking about factors which put you at more risk of having such illness or condition, in this case insomnia. The first risk factor for insomnia is gender. Women are more likely to have insomnia than men, and as well, elderly people are more likely to have insomnia or sleep difficulty than young people. Other risk factors include long-term illnesses, mental health issues, and working night shifts or shifts that rotate. Now that we have discussed what insomnia is, the types, the causes, and the risk factors, let's also look at the symptoms or signs that show that you're having insomnia. So what are the signs and symptoms of insomnia? The symptoms of insomnia include sleepiness during the day or at work, fatigue, grumpiness, and having problem with concentration or memory. Now, having said all that, I know you would probably want to know what this treatment of insomnia is. And well, yes, there are treatments for insomnia, but as for the acute one, which is the short-term one, which is not caused by any pre-existing illness or health issue, it might not need any treatment because it's a short-term one and it's not caused by any health issue. And if you are having difficulty functioning during the day due to too much tiredness or fatigue, as we said, is one of the signs of insomnia, your doctor might prescribe some medications or sleeping pills for you for a short time in order to cure your or correct your sleeping pattern. For the chronic type of insomnia, this might need a thorough investigation and treatment, where your doctor would need to first identify your health issues that are causing your problem and treat them accordingly in order to subsequently treat your sleep difficulties. If you have the chronic type of insomnia, your doctor may also suggest behavioral therapy, which will help you get rid of habits that you do which make your insomnia worse, and you get to learn new things that you would do which would promote sleep. The last thing to talk about is the complications that insomnia may lead to. Our bodies and our brains need rest. They need sleep so they can repair themselves by themselves. Sleep is also important for learning and keeping memories. And if insomnia is keeping you awake, you could have high risk of health problems such as high blood pressure, obesity, or depression, and a higher risk of falling if you are an elderly person. You could also have trouble focusing, you could have anxiety, and also you could have a slow time reaction. You could not react to stimulus in as fast as you need to, which could lead to car crash or accident. Now that we have discussed what insomnia is, the types of insomnia, the causes, the complications, the signs and symptoms, the treatments, I know that by now, or I hope that by now, you have some kind of little understanding as to what insomnia is and what you can do to avoid insomnia. I have also posted a small list of tips that can help you prevent insomnia on my Instagram page at dr.asars, Dr. Asas. So please check out my Instagram account, and I believe the link is down below or somewhere there. And don't forget to subscribe to my YouTube channel, Dr. Asas, and share this video with your friends and family. You don't know who it could help. So as always, thank you for watching, and I will see you next time.